Imagine this. A drug that's supposed to be safe and effective, but turns out to be neither. That's the chilling reality of Mifepristone, a mail-in abortion drug that's been under scrutiny. But here's where it gets controversial. Alaska's Attorney General, Treg Taylor, has joined forces with 21 other attorneys general to demand a thorough review of this dangerous drug and the reinstatement of safety protocols that were carelessly discarded by previous administrations. Let's dive into the details and see why this is such a hot topic. And this is the part most people miss. The real-world impact of Mifepristone is far more alarming than what's advertised. In a July 31st letter addressed to U.S. Health Secretary Robert F. Kennedy and FDA Commissioner Martin McCarry, the attorneys general laid out some shocking facts. Recent comprehensive studies have shown that serious adverse events from Mifepristone occur 22 times more frequently than what's stated on the drug's label. Moreover, the drug is less than half as effective as claimed. These findings directly contradict the drug's primary marketing message of being safe and effective. The AGs commended Kennedy and McCarry for taking this new information seriously and committing to a full-scale review of Mifepristone and its labeling based on objective data. But why the sudden push for a review? The letter cites a large-scale study by the Ethics Public Policy Center published this past spring, which reveals that Mifepristone abortions result in serious adverse events for more than 1 in 10 women. This rate is 22 times higher than what's currently on the drug's label, and the failure rate is double what's indicated. The EPPC's report is based on a review of 2017 to 2023 data from an all-payer insurance claims database, including over 865,000 Mifepristone abortions, the largest known study of the abortion pill. The study analyzed diagnosis and procedure codes using the official FDA definition of a serious adverse event. These events included sepsis, infection, hemorrhaging, surgical procedures after failed abortions, and complications from confirmed ectopic pregnancies. The AG's letter observes that the EPPC study appears more comprehensive than the clinical trials relied on by the FDA in 2016 when it approved label changes that removed most of the critical safeguards. The FDA removed important safeguards starting in 2016, which may explain why the real-world risk of serious adverse events from 2017 to 2023 is so much higher than the risk identified in clinical trials. The original FDA approval from 2000 required 7 key safeguards due to the known dangers of the drug. This included 3 in-person office visits, 1 for the administration of Mifepristone, another for the administration of misoprostol, the drug that completes the abortion, and a final visit to check for complications. It also limited the drug to unborn babies that were 7 weeks gestation or less, and required a physician's prescription with drugs being taken in a physician's office. However, by the time the FDA implemented the current Risk Evaluation and Mitigation Strategy, REMS, in 2023, the FDA, under Presidents Obama and Biden, had increased the gestational age to 10 weeks and eliminated every other one of these requirements. Currently, a woman can obtain a Mifepristone abortion by participating in only 1 telehealth visit with any approved healthcare provider, ordering the drugs through a mail-order pharmacy and self-administering them. The prescriber is only required to report an adverse event if they become aware that the patient has died. The letter concludes by criticizing the FDA's removal of these crucial safety protocols in 2016 and 2023. Questioning whether the removal was motivated by considerations other than the safety of patients. The EPPC study reports that in the years since the safeguards have been removed, the risk to women is far higher than was previously thought, and far higher than the label indicates. The current FDA's dedication to the health and well-being of all Americans is encouraging, as is the much-needed review of Mifepristone that Secretary Kennedy has promised. So what do you think? Should the FDA reinstate the safety protocols for Mifepristone? Or is this all just a political stunt? Share your thoughts in the comments below, and let's get the conversation started.